Hello, my name is Susan Lucas. I am a local independent sales agent and Medicare educator with My Insurance Solutions. I will be talking about the ABCDs of Medicare and explaining the different parts of Medicare and how they work. I am not connected with or endorsed by the United States government or the federal Medicare program. I offer Medicare products with multiple private insurance companies. Before I get into the meat and potatoes of the ABCDs of Medicare, I like to share a little bit about why I became a health insurance agent, which is my family. The pictures to my left include my parents, my sister, and one of my aunts, and my grandparents. Growing up, my family was always very close. One of my grandparents lived right next door to us, and the other grandparents lived with us as they aged, because they didn't have the means to stay at home on their own. I was around a lot of conversations regarding Medicare and health coverage when I was younger. Not all of it was easy to hear, but it gave me an appreciation for working with people in the Medicare system and helping you understand what the different options are. The first part of Medicare is your original Medicare, or Part A and Part B. This is provided by the federal government for people who are age 65 and older. Some people who are younger than 65 may qualify due to disability or other circumstances. Part A is premium-free for U.S. citizens and legal residents who worked and paid taxes for 10 years or 40 quarters. Part B has a premium of $144.60 per month, but that could be higher depending on your income level. This is what your Medicare card will look like when you receive it. It is a red, white, and blue card with your name on it. In the middle is the Medicare identification number, which is a combination of numbers and letters that is specific to you. And at the bottom, it tells you when your Medicare Part A and Part B started. Your initial enrollment, as I stated previously, takes place when you turn 65. You will have 3 months before the month of your birthday, the month of your birthday, and 3 months following the month of your 65th birthday to enroll in Medicare and any additional benefits that you may want. If you are receiving Social Security benefits at the time of your 65th birthday, your enrollment in Part A and Part B will be automatic. However, if you are not receiving Social Security benefits, then you will have to initiate the enrollment process. You can do this by going to ssa.gov and enrolling online. I recommend people start enrollment early, about 100 days before their 65th birthday, to avoid gaps in coverage. You may refuse or delay enrollment in Part B if you are still working when you turn 65 and have employer benefits or coverage through a spouse. Once you have your Part A and your Part B, you may also enroll in a Medicare Advantage or a prescription drug plan and Medicare supplement. First, let's talk about some of the details of your coverage with Original Medicare. Part A is premium-free for most people, and this covers your inpatient hospital care. There are deductibles, copays, and coinsurance costs associated with Part A. If you have an inpatient hospital stay, the first 60 days will be covered after you pay a deductible of $1,420. And then, starting on day 61 through day 90, you will have $352 per day copay. Part B of Medicare covers your medical services and preventative care. The premium for Part B is $144.60 per month, but this could be higher depending on your annual income. There is a $198 annual deductible for Part B. Some of the covered medical services that take place outside of a hospital are going to be your doctor's visits, lab work, x-rays, ambulance, outpatient procedures, and surgeries and other preventative care. In general, you want to remember that Medicare will cover about 80% of your healthcare expenses, and you are responsible for the other 20%. To make up the 20% that original Medicare doesn't cover, you have a few options. Option 1 is to enroll in a Medicare supplement insurance plan and a prescription drug plan. Option 2 is to enroll in a Medicare Advantage plan, also called Part C. In most cases, your prescription drug plan or Part D will be included in your Medicare Advantage plan. In a minute, I will go into some more detail about the different Medicare plan options. I am available to assist with your Medicare benefits and enrollment. You can schedule a one-to-one with me to discuss your specific needs by calling 707-656-8457. First, let's talk about some of the benefits of a Part C or Medicare Advantage plan. Medicare Advantage is known as an alternative to original Medicare. Members of a Part C plan will still be part of the Medicare program. However, all of the benefits, including your Part A and Part B, are going to be administered by the plan. These plans are offered by private insurance companies, and they will have a specific network of providers and facilities they use. They are generally either an HMO or a PPO plan, and you must continue to pay your Part B premium as well as any premium the plan may have. Some of the benefits of a Medicare Advantage plan is that it will help pay for your hospital stays. It also helps pay for some of your medical care like your doctor's visits and preventative services like the flu shot. It will help pay for your prescription medications and may include routine vision coverage and hearing exams. A very good benefit of Medicare Advantage plans is that it does limit your annual out-of-pocket cost. Now, let's talk about Part D, or your prescription drug coverage. There are two ways to get prescription drug coverage. One is through a standalone Part D plan, and the second is through a Medicare Advantage plan that includes prescription drug coverage. All of these plans are offered by private insurance companies. It is important to review your prescription drug plan to make sure that the medications that you're taking are on the formulary. Some important features of prescription drug coverage plans is that they will most often have a pharmacy network. They will have preferred or standard pharmacies and also mail order pharmacies that you can use. Generally, either the preferred or mail order pharmacy is going to give you the best value on your medications. It's also very important to check the formulary list or drug list to make sure that your medications are going to be covered. The last thing to be aware of is the tiered formulary, because this could affect your medication costs as well. In general, most plans have a 5-tiered formulary. The first tier will be the least expensive medications, which are your preferred generic drugs. Tier 2 covers generic drugs and will cost a little more. Tier 3 is going to be preferred brand name drugs. Tier 4 is non-preferred drugs, and Tier 5 are your specialty medications. There is something called the coverage gap, or donut hole, that also applies to your Part D coverage. The coverage stages for a Part D plan start with the annual deductible. Not all Part D plans have an annual deductible. The next stage after the annual deductible is the initial coverage phase. During this phase, you pay your copays and for your medications, and the plan provider pays the rest until you reach a total drug cost of $4,130. At that point, you enter the coverage gap. While in the coverage gap, you're going to pay 25% of the drug cost for both brand name and generic medications until you reach a total out-of-pocket cost of $6,550. Once you reach the out-of-pocket maximum of $6,550, you will enter the catastrophic coverage phase until the end of that calendar year, with copays under $10 for both brand name and generic medications. Many people will never reach the coverage gap, but for those who have a lot of medications, this is something they will need to be aware of and budget for. This cycle does start over every year on January 1st. For people with a limited income, they may qualify for extra help to cover some of the copays, insurance, and deductibles associated with Part D. Let's take another little break here. I want to remind you that you can always call me to schedule a no-cost one-to-one appointment regarding your specific needs and questions about Medicare. My phone number is 707-656-8457. Now, let's talk about Medicare supplement insurance plans, sometimes called Medigap plans. These are federally standardized plans provided by private insurance companies, and they help pay for some or all of the deductibles, copays, and coinsurance not paid by Original Medicare. You cannot use this with a Medicare Advantage plan. You would either have a supplement and prescription drug plan, or you would have a Medicare Advantage plan. There are 8 plans, lettered A through N, available nationwide. However, there are 3 states, Massachusetts, Minnesota, and Wisconsin, that have different standardized plans. Medicare supplement insurance plans are not tied to a specific network. Therefore, they are particularly suited for people who have multiple homes in different states. Here is a snapshot of the different Medicare supplement plans that are available. As you can see, each plan has a specific percentage that it covers for your deductibles, copays, and coinsurance that Original Medicare does not cover. To get a quote on premium costs, contact me at 707-656-8457. I want to remind you again of the different coverage choices that you have when it comes to your Medicare benefits. First, you will need to enroll in Original Medicare, which is your Part A and Part B. Once you have Original Medicare, you have 2 options. Option 1 is a Medicare supplement insurance plan and prescription drug plan. Option 2 is Part C, also called Medicare Advantage plan, including prescription drug coverage. I do want to talk briefly about the additional enrollment periods. Your initial enrollment period is the 7 months around your 65th birthday. There is also an annual enrollment period every year from October 15 through December 7th, when you will have the opportunity to review your Medicare Advantage and prescription drug coverage. There are often changes to plans or new plans available during the AEP. From January 1st through March 31st is the open enrollment period for beneficiaries on a Medicare Advantage plan. During OEP, you can drop or enroll in a different Medicare Advantage plan or return to Original Medicare and a prescription drug plan. Then, throughout the year, there are also special enrollment periods that are triggered by qualifying life events or changes. This could include retirement or losing employer health coverage, moving out of the plan service area or out of state, a change in Medi-Cal or extra help status, or diagnosis with certain qualifying disabilities or chronic health conditions. There are some late enrollment penalties if you are qualified for Medicare and don't enroll. This does not apply to people who are over 65 and have health coverage through an employer, spouse, or union retirement plan. Most people will not have a premium or penalty for Part A. However, there are some circumstances that a 10% penalty could apply. If you do not have coverage through an employer, spouse, or union plan, then there is a 10% penalty for each 12 months that you go without Part B coverage. For Part D, if you lose coverage for longer than 63 days, then there is a 1% per month of the national average premium, which is about 35 cents per month, as long as you do not have Part D coverage. The Part D penalty continues to accumulate, and it does not go away unless you qualify for extra help or Medi-Cal. People who qualify for Medi-Cal or extra help and Medicare may be able to enroll in specific plans that are designed for dual beneficiaries. If you need help finding out if you qualify for Medi-Cal or extra help, please contact me at 707-656-8457. I know we've covered a lot of information here, and I know that it's confusing. I am offering anybody who comes to one of my Medicare events, whether that be live or virtual, a no-cost Medicare session to discuss your specific health needs and Medicare options. There are a lot of choices, and I would be honored to help you review your retiree or union plans, supplement and prescription drug plan, or an Advantage plan. I will help you navigate the different benefits and cost so you can make a decision that meets your specific health needs and budget. I want to end by thanking you for taking the time to join me today. I hope that you were able to get some of your questions answered about the basics of Medicare, and I welcome all of you to contact me. You can call me on my phone at 707-656-8457, or you can email me at susanlucas@myinsuranceSolutionsinc.com. As a reminder, I am a licensed health insurance agent. I am not employed by any carriers that I represent. I am a local independent agent, and it does not cost anything to have a meeting with me to discuss your healthcare needs. Thank you.